I will call to order this benefits committee, which was duly noticed April 4th, 2022 through posting notification of the press in accordance with Wisconsin statute 19.84. The safety message, I'm going to read right from the newspaper. This is Severe Weather Awareness Week. Rock County will resume monthly outdoor siren testing on Wednesday, April the 6th at 12:05 p.m. Siren testing will be done from April to October on the first Wednesday of every month. If there is a threat of severe weather, testing will be postponed until the following Wednesday. During a test, the sirens will steadily sound for 1 to 3 minutes. Did that happen yesterday?
It happened today.
Mm-hmm.
Happened today.
Oh, today is Wednesday. It did?
Oh,
Sounds
yeah.
good.
Yeah, because I had just got home walking my dogs, and all of a sudden, it's like, what in the heck? Because they both went off in terms of howling, and then I realized, oh yeah, that's the sirens.
But Wednesday is the test day.
Today, Wednesday.
Today.
Oh, it is Wednesday.
Yeah.
Why am I thinking it's Tuesday?
That's all right.
Another Prevagen moment.
How about a motion to adopt the agenda as presented?
So moved.
Can I second it? Am I allowed to second? Okay.
I seconded.
All right. All those in favor?
Carl seconded for you.
That's okay. Kevin can.
All those in favor say aye.
Aye.
He doesn't
All
get
right.
excitement otherwise.
So before we get started, I just wanted to thank the board and the administration and for keeping our employees on the table and always concerned about recruiting, retaining, and rewarding our employees. It's something that we continually discuss and are careful to address, the best we can as often as we can. And I think tonight's agenda is based on that, is recruiting, retaining, and rewarding our employees. We have a lot of items. A lot of it is informational. We felt that new board members or existing board members, it's good to review and understand what some of our benefits and working conditions are as we explore possible new ways to address these issues, or at least keep some things on the table in the back of our mind, as the years go on. So our first one, and thanks to HR staff, in particular benefits, for putting us all together. It was a lot of work. So Tina, do you want to kick the ball off here with 4.1, presentation on OPEB relating healthcare benefits?
Sure, absolutely. Good afternoon. It's great to see everybody today. You'll notice in the packet that was sent out, as Kevin alluded to, just trying to give an overview of our OPEB benefits and what they look like so that everybody can have a clear understanding of what they are. And then also some supporting documents directly from the employee handbook, which all employees of the School District of Janesville have access to. So I'm going to go through just a high-level review. If you want more details, you can find those within those other pages in the packet. Okay, so I'll see if this thing will work for us. We're going to start out with, great to see you. Part of our employee health benefit includes an HSA, which is a health savings account. So wanted to give you an overview of that. It's a tax-favored savings account created for the purpose of paying for medical expenses. It can pay for anything from any of your care to vision, to dental, to over-the-counter medication. And annually, we send out a list. The benefits office sends out a list to our employees so that they can have an idea of anything new that may be added to that list that the health savings account can support. The unique piece about this is that it is tax-free. It's tax-deferred, so that money is yours. You every month you can contribute a dollar amount if you would like to into your HSA, not to exceed some limits, which we'll talk about in a minute. And then they grow it and grow and grow. And if you leave the district or go someplace else, that money goes with you. So it's really a nice benefit to help save for your future as far as your medical expenses are concerned. A little noise. We've got people coming in. Couple of other parts of the HSA would include that a single plan, the total contribution limit is $3,650 annually. That's a January 1st through December 31st year. And for a family plan, the limit is $7,300. As an additional bonus, if you are the age of 55 or older within that year, you may contribute up to an additional $1,000 per year. Currently, the school district seeds the single plan. $600 seeding is what we call it. It's a contribution on behalf of the district to the employee, and $1,200 for a family plan to each employee that participates in the HSA. That money does also go toward the total contribution. So we have a calculator that we created last year that gets sent out to the employees so that they can try to determine how much money each month works for them and their budget to save and hopefully max out those accounts so that they can really take full advantage of that benefit. I think we covered everything. Our district is supported by Johnson Bank and Blackhawk Bank for their HSA accounts. There are their two options, and when they go through open enrollment, they have the opportunity to choose either one of those two banks to house their HSA.
Just a
Kevin.
question about this. Thank you very much. So as of today, the board has made the assumption that this continues to exist, the seating for our employees in the budget plan so far.
That is correct.
Okay, thank
That
you.
is correct.
All right.
Any other questions on the HSA? Commissioner Hanaway?
Does that roll over year to year?
Yes, it does.
Okay, so if we put 1,200 in for a family and they don't use it at all, we put another 12 the next
That
year?
is correct.
Very nice, thank you.
That is correct. Any other questions with that? Commissioner Dahmershausen?
Yeah, I'm just asking, that was a good question to ask, but the other part of the question is, at the end of the rope, you retire.
Yeah.
Where does that go? What if you haven't used it all the way
It's
up?
all yours.
Can I take it?
Yes, it's all yours.
Even though it
Your
isn't,
money.
even though it isn't medical,
Yep, it's all your money.
at the end of our service
Yes.
in the district?
It goes with you. Even if you leave the district, it goes with you. It's your
Okay.
money.
Yeah, I'm just kind of thinking of, there's 1,200 left from you, 1,200 from the district, say, in there, and you retire.
Mhm.
But do you have to use it for medical reasons at that point? At
There-
what point is it just money you can have?
Sure, there are rules that you can utilize it. You would talk to your accountants for that, but certainly you can no longer use it toward the district medical plan. And when it comes to Medicare, you can use it for some costs with that, and then still continue to use it for vision and dental, for over the counter. That's the purpose of an HSA.
Okay. But if you at the end of somewhere, if you use it, you have to pay the taxes on
That
it,
is
don't you?
correct. Yes.
No, there's never taxes on this.
Oh, when you pull out and if you pull out and you want to use it to buy a deck or buy a boat,
Yeah,
And-
but I think once you turn 65,
then you don't have to.
then you have flexibility. Up until 65, you can only use it for medical.
So
Otherwise, you get
if
taxed.
you're fortunate enough to be healthy till then, you're building a nice savings account.
Absolutely.
Thank you.
Very good. Thank you for that clarification. All right, moving on. What is OPEB? Other post-employment benefits. So this refers to health insurance benefits and the payout for employees. And they receive that as an early retiree, which is age 55 to 64, from the School District of Janesville. Now, we have to remember that we have two different retirements as educators. You have the school district retirement and you have the WRS. So for the purposes of where we're at, this comes up a little later, but all employees that work 4.8 hours or more per day qualify for the WRS, which is the Wisconsin Retirement System. And that's a state funded, and we pay a portion, we pay half of that. It's at 13.5% or something to that effect right now. So employee pays half, the employer pays half into that account, and it grows. So that's the WRS. What we're going to talk about today will be more related to the School District of Janesville OPEB plan. So there's a separate retirement there. And what that is to be eligible, you have to have worked at least 10 consecutive years in a full-time position which is 7 hours per day or more, immediately prior to retiring. And you have to be at least age 55. Eligible employees hired on or before July 1st of 2015 would receive the board paid benefits and or sick leave payout. And eligible employees hired after July 1st of 2015 receive only the payout for accrued sick leave. And we'll talk a little bit about that now. Yes.
The working 10 consecutive years at full time, I'm trying to figure out how to word it because it is comparable to the county. If you work, let's say you only work part-time, does this still apply if you work part-time?
Nope, you have to work full time.
You have to work full-time. It's not like you get so at the county, if you worked full-time, after 10 years, you were good. But let's say I was a 0.5 at the county, I'd have to work twice as long for this to kick in. That doesn't,
No, we
this
do not
does not
have that.
affect any of our less than an FTE.
No.
Okay.
Okay. Excellent. So what we're going to talk about now are the sick leave payout and what that looks like and what it's used for. So this is for the group that's eligible, hired on or before July 1st of 2015. They receive the board paid benefits and or sick leave payout. So any unused sick leave conversion for additional months of coverage or payout into the tax shelter annuity. So we have two banks. The first bank is sick leave accrued on or before July 1st of 2015. These days can be converted at the amount of $147 per day to purchase additional health insurance months of coverage in their retirements, and it's based on the premium rates at that time. These days can only be used to purchase additional months of health insurance and will not be converted for any other benefits at the time of early retirement. Nope, it's okay. Thank you. So we'll go back on that. So that first bank are the days that are accrued before July 1st, and they are used solely for the purpose of buying additional health insurance at the point of retirement. If those employees have to during the year, they can use any of those days for FMLA leave or that's pretty much it, FMLA. Now for COVID, we opened that up. For COVID, we allowed people to take those days and utilize those days in the event that they needed to do that. For Bank 2 sick leave days, they're accrued after July 1st of 2015. And again, they will be paid out at $147 per day to purchase additional months of health coverage. If the employee reaches age 65 before going through all of those accrued days, they get that paid out into a tax sheltered annuity at $147 per day. Questions on that? There's no cap. No cap. Okay, very good. Next slide. Now we're going to talk about the employees that were hired after July 1st of 2015, and they would receive only the sick leave payout for accrued sick time. There's no board paid benefit, and we'll talk about that piece in a minute. But these individuals can accrue their time, have been accruing their time since July 1st, and again, can use that for FMLA. And any kind of medical leave that they may have. And again, we opened that up for COVID. But at the end of their time, if they're 55 years old and have been in a full-time position for 10 years just prior to their retirement, they will get their entire accrued bank paid out at $147 per day into a tax-sheltered annuity. Okay. Excellent. Next slide. This is where we talk about the early retirement benefits and the schedule that was created, back in 2015. And what this entails is different employee groups based on when they were hired or when they're eligible to retire would receive board paid benefits. So anybody who is eligible to retire and retires before June 30th of 2025 receives 3 years, 36 months of board paid health and drug coverage. Okay, you may purchase additional months of coverage by converting your sick days at a rate of $147 per day. So if an employee has had great attendance and they've accrued a bunch of time while they were here, they could get upwards to 5 months or 5 years, 6 years of coverage on in their retirement for their medical. Okay, the next group eligible to retire and retires between July 1st of 2025 and June 30th of 2035 receives 24 months or 2 years of health coverage, and the same rules apply. They would also be able to accrue their time at $147 per day and purchase additional health insurance toward their retirement. And our last group that qualifies would be anybody eligible to retire and retiring between July 1st, 2035 and June 30th of 2045, or until the last employee hired prior to July 1st of 2015 is eligible for the early retirement benefit. Those employees would receive 1 year, 12 months of health and drug coverage, board paid, and then may also continue to purchase health coverage at $147 per day based on their accrued time. So that's that first group that falls into that pretty much 25 more year window that we are paying out OPEB benefit on. Then we have the employees hired after July 1st of 2015. They do not receive a board paid benefit, but they get to accrue all of their time and have every day paid out at $147 per day into a TSA. So that's just money that they would take for their sick leave time. And these are supported by Board Policy 4500 and the SDJ Employee Handbook. Yes?
Did we add something in there that said, but you have to stay so long before you get these dollars?
It's the 10 consecutive years prior to retirement.
So an individual hired after July 1, 2015 needs to work 10 years before they can receive this benefit.
And be 55 years old.
Okay,
So that's part of that eligibility.
thank you.
Yes. This gives you a little bit of a breakout of our employees, how many numbers we have, where they sit, and their eligibility. This is really kind of interesting, the way this is broken out. It's the first time we've really broken these numbers out as we try to really get a better understanding of where each of our employees are and how we can better serve them from our departments. But there's categories that are associated with regular employees. So if you look at the top there, you'll see full-time 12-month employees, full-time school year employees, part-time 12-month employees, and part-time school year employees. Here's where the catch gets a little bit interesting. Full-time status in HR, so if you ask the HR office, they will tell you that it is defined as a 35 hours or more per week. A part-time status in HR is defined as less than 35 hours per week. From the benefits office perspective, an employee who works 30 or more hours are eligible for district health benefits. We call them full-time because this is based on the rules of ACA. Okay, so then beyond that, employees who work 35 or more hours as are qualifying as full-time employees through HR, they would qualify for the OPEB in retirement. So we have two different categories, like basically the 6.0s to the 7.0s are only eligible for health benefits while they're employed. 7.0 and higher are eligible for the retirement benefit. Okay, so that was agreed upon by the board back in 2014. Now, so you have an idea of what the breakout is. Our full-time staff, and again, I'm benefits, so I'm talking from a benefits perspective, 6.5 to 8.0 hours, we have 1,211 employees who fall in that category. From a part-time staff perspective, we have 5.7 hours and below, we have 270 employees that fall in that category, for a total staff number of 1,481. And this does not include coaches, substitutes, or long-term subs, those kinds of people. So currently, employees who are eligible for board-paid OPEB health insurance, those who are eligible for 3 years, we have 205 employees still on that are eligible for that 3-year benefit. Now, We have a multitude of people who are 62, 63, 64 years old and will fall off that eligibility because once they turn 65, they go directly to Medicare. So that's a factor that we really can't add into the equation, so we took the whole mass of them. Same goes for the rest of the categories. So eligible for 2 years of coverage, we have 256 employees. Again, some will fall off, and some of those may qualify at age 55 for the previous category. And then eligible for 1 year is 120, for a total of 581 employees currently active who are eligible for the board-paid health benefit in retirement. So if you look at that number, we have 581, do the math on that, less, 12, 11, you're sitting pretty close to dead even on who gets paid out for the 147 per day into a TSA for retirement versus who gets the board paid benefit. Questions on numbers? Yes, Commissioner Hannaway.
What's the significance of that little 8 in the last box with the 581 total?
That is the page number.
Oh, I'm sorry.
It's okay.
I didn't see a page number on the other one. Oh, okay, I do, it just didn't fall in the box.
Yep.
No page number.
Any other questions there? Very good. That's pretty much the overview on where we're at with OPEB. Any questions on item 1.4?
And the rest of this documents are just copied pages right out of the
That is
handbook.
correct. Mhm.
So it's the same information, but post Act 10, the handbook is now really the guiding principles of all that governs benefits, working conditions, right?
That's correct. And we do quarterly updates to the handbook. It's reviewed on a regular basis, and we have a running document through departments that if somebody comes up with something that we need to address or work through, we do that, and then the employees are shared out any changes, as well as they are asked to sign off that they have read the employee handbook at the very start of every year.
All right. Good, Carl?
Yep.
John?
Nicely presented.
Any other board members got any questions? Nope. Okay.
Just keep
Perfect.
going. Excellent.
That was a great
Absolutely.
summary, right? Yeah.
Very
Great,
simplistic.
thank you.
Yep, okay. 1.5, discussion on OPEB sick leave payout with consideration to move to full board. So 1.5, do you want to talk about that, or do you want me to?
You go ahead and start, and I'll
Okay.
provide the supporting information for you.
So, so there's the history of what Tina just showed us. There's a history to it. So before 2015, those eligible for early retirement benefits were given 4 years of health care paid by the district. And you could earn up to 4 additional more years by using sick days. There was a sick day conversion. So you could get up to a total of 8 years. So for various reasons, and so we got to the 2015 plan. And at that time, we determined $147 was one and a half the substitute pay rate,
That is correct.
right? So here we are 7-ish years later, and it's still at the same rate, right? As we all know, the cost of health care continues to rise, but the ability of our employees to maintain or catch up to that cost is still the same as it was 7 years ago. So I asked Tina, can we explore what it might look like if we start talking about this in some detail? And we had to engage with Key Benefits, is that correct?
That is correct. Mhm.
Key Benefits is our consultant, as it's directly related to healthcare.
OPEB. Mhm.
OPEB,
So I would
closer
just,
to it.
let me just add to
Please.
that, what we do is every other year, we run an audit through Key Benefits to kind of get to a number for OPEB, and they go through every one of our employees. And I will say they have to, as an aggregate report, and they start looking at it. It's always as if nobody used time, everybody maxed out, right? So it's always based on those numbers when they do the figures. When Kevin first approached me on this, I said, we're in a year this year, we're in a cycle that in June we will be doing the full audit. So for us to go right now in January, I think it was, Kevin, and if we were to do it in January, that's kind of, we're just going to repeat it again in 6 months. So contacted Key Benefits, and they offered the opportunity for us to go ahead and choose $170 to see what that would look like based on those current numbers. Now, as we went through this process, we learned pretty quickly, and talking with the business office, trying to find where the monies were. We have two accounts. We have the Fund 10 and we have the Fund 73. Fund 73 is the account that we use for OPEB, which is our health benefit line. So we put money into that, and I'm going to rely on my friend over here in just 1 minute to help me to make sure I've got it all correct. And the OPEB, the benefits, the health benefits are paid into Fund 73. However, the sick leave payout is a pay-as-you-go. So it's a line item currently in Fund 10. So when this first got put in place, there wasn't the thought that this was going to be the dollar amounts that it was going to accrue to, or that just didn't happen. And so there's no budgeting for it. It's just year after year. It's just a line item payout, and you'll see in the columns as you're looking at that how much that's going to accrue. So it's significant dollar amount as we go through, and certainly we would have to make some changes in the way that we work the budget. Kevin, I'm going to stop there because I think you have more to say about this, and then we'll defer
Well,
to Dan.
Thanks for doing this work. I'm not asking for the committee to take, just my opinion, to take any action on this, but I think it's important for us to keep on our table as we move forward in light of all that we got going on currently with, negotiations, healthcare, and a couple other items that I think we could actually manage, but that's just my opinion. So we picked a random number, right, as $170. Can you just explain?
Sure. So we originally chose 210 because if we were looking at what would make sense from a scale perspective, and then Kevin took that back and I think had a conversation or two, and it was determined that's too much, that's too high. Let's come back and try to look at what. And I said, well, what do we want to do? Pick something in between? We want to just look at it, how exactly do we want to determine that? And so we just landed on 170. It was really rather random. I don't know that it was, any kind of science behind coming up with that number outside of the fact that we thought that it was a decent increase from where we were at right now. So that's where we landed. I think it's important to note, in the packet, you guys have a much bigger chart. There's the one on the screen here. I think as you look at 2025, 2026, it's no mystery that those numbers are up in the $500,000 payouts, because that's when our first group falls off of that 3-year board paid benefit. So all of a sudden now, all of those accrued days suddenly become more valuable because people are going to be using them to buy additional coverage, because they're now down to 2 years instead of having the 3 years. And so that's why that payout becomes that much greater at that time, as you look at that.
So at this chart, please correct me if I'm wrong. So over time, if you look at the first column, or the second column, I should say, under 147, our best guess at the longevity of our current plan, by 2050, we'll have spent $11,500,000, right?
Yep, that's correct. That is correct.
And if we just increase it to 170, it's a couple $1 million more. But that's over a long period of time, though, as to. So again, I thought it was just, and we thought it was important that we just at least have this on the table, and to know it's been 7 years out. And we did, when we rolled this out, we did say, we'll look at this. Well, it's time that I think we took a look at this. I don't think we can fit it into this year's operating budget or plan it into next year's, but maybe, the following.
Well, and I appreciate it. I mean, I think there's a due diligence we have, right? I mean, we get asked these questions and, is there any chance that we're gonna increase that dollar amount, or is there, what is that gonna look like? So from an employee perspective and from an employee, friendly perspective, it just says, yep, we're listening, we see it, we hear you, and we're taking a look at it. So I hope that that's heard.
Well, I should say, that's just my opinion. Now, when we report out to the board and they say, geez, why haven't we addressed this? That's a whole nother scenario. I'm not speaking for the board. I'm just, was speaking for myself.
Now, this is what we pay someone for being sick, a sick day?
For not utilizing their sick leave time.
Not, so this is what, after they've accrued this,
Correct.
okay? Let me think how to put this. But you don't get to use this until you've accumulated 10 years, correct?
And retired.
Or retiring. Do you, and this might be a question you can't answer, in general, when someone retires, do you have a rough estimate as to how much sick time our people are leaving with?
Oh my goodness. That range is very large, right? It's because you have so many people, people leave and have to utilize their FMLA. And so they burn through their time, right?
Okay.
And so they don't have any time. And then others have a lot of time, and then they're not on their health benefits. So then they get all of their days from July 1st, 2015 to current, because they're not purchasing health benefit.
Okay, and the
So-
reason I asked that is because at the county, we had people that we used to refer to as the earn and burn. They'd get their sick day, the next day they'd call in, or the next day, and then, when they had a issue, they had no sick time. You also had a lot of people, and we had a cap that capped at so much, and so there was a range. That's why I was curious so districts the same way, some zero and some way up here. All right, thank you.
Commissioner Damershausen?
You okay? Yeah. Okay. I want to understand this a little better.
Okay.
This is an obligation, a theoretical obligation, or is that a known obligation? These figures you have here,
Yes, okay, yes. Just
these are
real
known
numbers.
or theoretical?
Nope, they're real numbers.
These are actions, numbers from an actuarial study.
Okay, from an actual, so it's really theoretical, but probably accurate.
Okay.
They're an obligation the district has based on.
They're probably going to occur. Will they occur in that year, or how much we've accrued to that point?
Mr. McCray? Mr. McCray has some ideas and thoughts.
Well, it was a few years ago where all the accounting guides from the federal government created rules about you have to account for your post-retirement benefits, right? And it's all best guess, but we're committed to this. These are, as far as we're budgeting and planning, and as far as reporting out, these are real dollars. They may not all be in the bank sitting somewhere, but they are dollars that we are accountable for.
Right, through our Fund 10 or something in our OPEB account, right?
These are through Fund 10, because they're just a line
Okay.
item, because we're just paying as you go, whereas our OPEB benefit is through Fund 73, which is part of the conundrum, I think I would say, that we're in with that.
Now, these totals, and I'm looking at one here that stands out in 2028. That means that year, at 170 a day, I'll take a look at the worst one there, 768,974 we'll be paying out that year?
According to this document and based on their actuarial study, yes.
Theoretically,
Theoretically, yeah,
yeah.
If we go to 170.
correct.
Yes.
Okay, but it is much cheaper on the other end. 100,000 less. But anyway, no, I just wanted to know that's something, as we figure out budgets, that year, what we have to plan for. Now, if it comes in less, that's fine. if it comes in more, we have to make it up somewhere through Fund 10 or what we set aside or something else through it, correct? Work him over, go ahead.
So Commissioner Murray is spot on in terms of his analysis, right?
Right.
As well as Tina Johnson. Sorry for the, that's really loud. Speaker somewhere. So what you're seeing, right, is the actuarially determined contribution the district should be putting into a Fund 73 mechanism, similar to our OPEB health insurance liability. What we don't do with our health insurance liability is have a line item within our budget, but we do make a contribution every year.
Right.
We should theoretically be making these same contributions. So we have 3 studies. All right. One is our OPEB study. The other is we have 1 or 2 former administrators that are still part of a post-retirement benefit study outside of health insurance. And then we have this. But this has not been designated for a deposit to Fund 73. If we were to follow the same pattern and going to the year that you cited, which is 2028,
Right.
we should be putting in the current benefit level $673,000 into a Fund 73.
So we should be doing it this year, putting that level.
This year, we should be putting in $128,532. So that's row 2, column 2 dollar value.
I understand, but it's gonna grow fast.
It's going to grow fast based upon the actuarial study, right? So Jamie Brown and Tina Johnson, right, and others, we do
Yep.
this giant Skyward, which is our financial HR platform report, right? We crunch a lot of data. We provide that to our actuarial friends at Key Benefits, and I'm sure Ms. Johnson has shared this with you, but just a friendly reminder, right? Those actuarials are very smart, right? And they come up with, to Commissioner Murray's point, right, essentially a GASB requirement, right, to present this as part of our annual fiscal audit, as well as to do our due diligence to
Okay.
really make these deposits to pay these benefits.
So therefore, it's safe to say that we're gonna be putting in each year a significant amount of money over the past year to a certain time. Then it'll decrease somewhere into our budget.
I think Commissioner Murray has a thought there, and I didn't want to interrupt.
Well,
Okay.
go ahead, John.
It looks, but what I'm looking at, it also looks like it's a bell curve,
Yep.
and that, we're gonna peak sometime in the late 20s, early 30s, and then it's gonna start dropping off again, correct?
Correct.
All right, and that's because of the retirements that you had spoke upon earlier, correct?
Increments in which people drop
Right.
off the plan and then are using just their time as accrued. And this is only for the accrued time, right?
Okay.
This is only count for the accrued. It has nothing to do with the health benefit.
Okay.
Well, all I'm trying to do is make sure that the board and the public is aware of our obligations that are going to be coming. And that we have to plan that way. And I think as we go forward, there'll be certain things happening that will have to be operational funds and things like that to make sure we can cover these. And that we owe that to our employees, we owe that to the public to know that. So anyway, that's all I'm trying to do. And if I understand it better, I hopefully other people do. And that, thank you so much, everyone. It's really welcome.
Anyone else? Questions about $147 relates to post-retirement benefits?
You said earlier, this has been in the making for some time, and where do we go from here? I kind of sensed a few minutes ago, coming from you, okay, what do we do now? We've said we're gonna review it. Does it go to the full board? What do we, that's where, you following me?
Yes, I do.
All right.
So when we report out to the board, unless one of you gentlemen wants to make a motion, to direct or ask the board to do something, we'll report out to the board is that this is on our table, this is the history, this is why we talked about it. It's a benefit. And if some board member would like us to do some more work on this, we could bring it back to committee and say, well, we have, we've got authorization from the full board to explore any other number or no number other than 170. Or it could be anything similar to that. I guess in light of everything else that we're dealing with, I don't know that it's fiscally responsible to address this right now. That's just my opinion.
Other
That's-
than just letting the board know that we're looking at it, it's ongoing.
Yes,
And I like that.
it doesn't hinder any other board member saying, hey, we got to do something. And then, well, we'll see.
My thought is it's a little bit scary with declining enrollments unless we're expecting something different. And we have just so much money, and we do know one thing, the legislature or the Senate isn't about to give us another penny unless somebody tortures them to death or something to get it out of them. We have to, it's a serious thing that could come up there, and that kind of extra money, and we still have to take care of our educational obligations. It's scary. So I think we need to report out and ask for what do we want to do to address this as we go forward? We can't be pulling, rabbits out of the hat to finish the budget. I know the guys there and the girls in finance do a wonderful job making us aware of things. But I see it isn't just small amounts going up. I see big amounts.
The thing you have to keep in mind too, the reason we transitioned to this plan is the plan we had prior, it was not sustainable. The full 8 years, as much as we'd like to have maintained that, this is a highly functional plan right now. It's just being concerned that our employees have enough money in their HSA to purchase healthcare at a value. When they, if you're here for your career, we want to be able to have you purchase healthcare.
Yeah.
And hopefully retire early.
Yeah.
Okay.
This isn't to put them down, our employees. This is just find a balance of how we're going to do this. And I think that's important, and I do think it should be poured out to the board, and hopefully they can give us direction.
I hope you voiced your opinion that way when we roll this out. Perfect. Yeah. Anyone else? Kathy?
I'm good,
Okay.
I'm good. That's the process, this is the committee process,
Yeah.
what it's all about.
1.6, part-time employee benefits, unused sick days with consideration to move to the full board. This is another item that was, Bettina, when we've been for it once,
Yes.
a little help. My quick one.
Thank you, Patrick. So if you look at this timely document that Tina gave us, where it tells us how many employees we were talking about.
Yep.
So on here, it states we have 270 part-time employees that aren't eligible for healthcare,
That is
post-employment healthcare. And these individuals do get sick time, which I know they're grateful for because many of them use it for family medical leave, for, all those related issues with personal illness, family illness. But I also discovered, though, that when these individuals, not that they resign, but when they retire, that their bank of sick time there's no benefit for them, if you understand what I'm saying. So this is another one of these items that I'd like for us to at least keep on the table as well. I don't have a solution to this. it was probably premature for me to ask Tina to work on this, but again, it's like what you talked about earlier, with some employees at the county. So here's an employee group, they're hardworking, they have sick time, but when they leave or retire, why wouldn't they just use sick time if there's no value to it? So I'd like to report this out to the full board as well, as like, well, are we willing to attach any sort of value to a sick day for a part-time employees? And here we go again. Well, Marie, what are you talking about? For every dollar we talk about, you have to account for it somewhere. Or maybe there's something else. Maybe there's some other value other than monetary that we could attach to it. I don't know. So again, Tina, do you have anything to add
I
on
don't,
this?
I would just say that I was also asked to, chime in with other districts, and I'm on a
Oh, yeah.
consortium that has 28 other districts, and none of them offer a part-time benefit.
None of them do?
None of them do.
Go ahead.
Yeah, that would be my concern because you almost penalize a good employee, a good part-time employee. And then at a certain point, if I'm a part-time employee, I guess I wouldn't do this. I think I have better scruples than that, but I've known people that have said, I'm gonna lose all this. I'm getting nothing out of it. So I'm gonna start calling in. I'm gonna start using some of my sick time because once I'm gone, I get nothing. So I agree. I think we've got to. I know there's a cost here, but there's no incentive to you bank your time or save it up, especially if you leave, because you're not gonna get anything out at the end. Then
So, first of all, from what I know, our employee group does not abuse their sick time. That we have a very successful employee pool that is very conscientious about their use. And sick time, particularly if you're a new employee or even a part-time employee, I know some that have been very, very sick. And because of their sick leave pool, have been able to use their accumulated benefit to continue to get paid under the Family Medical Leave Act. So it's not that there isn't any value.
okay.
It's just, it's like, well, we're always constantly thinking and talking about recruit, retain, and reward. And we're really into this mode right now, and it's a constant competition with other employers. So this is just another beginning of a conversation, I think.
To keep on the table.
Yeah. Is
I
that
will,
fair?
I will add this.
Yeah.
In the private sector, at least where I work, I'm a part-time employee. I am offered benefits, health insurance, but nothing accrued like this. I get vacation pay I can use, and I accrue that. I am allowed all the dental, the life, and all those benefits. So I say this is healthy to continue to offer to the part-time employees, because they're as hard to get as full-time employees, I believe, aren't they? Don't we have a hard time recruiting good part-time
I think
employees?
right now
The
it's we're at a shortage of people just in general across this country as far as hiring is
Yeah,
concerned. So
yeah.
I hate to pigeonhole what groups and how that all works, but definitely our part-time employees certainly have had opportunities to move into full-time positions where they would obtain a benefit. And if that's something that they were, desiring and wanting or needing in their families, they certainly have that opportunity in twofold, I would say, in the School District of Janesville.
Yeah, and this is almost unheard of in the private sector, that they get these part-time employees get to accrue benefits like that. So, and I'm in favor of it as such. Fortunately, I'm over 65, so I don't have that big a need for them. I don't pay a premium every month. It's all taken care of by the government because I'm a veteran. And most veterans, if they, depending on what they earn today, and that get different deductibles and have to pay certain amounts and that, but fortunately, I'm a low pay, so I'm okay. So just wanted to say, keep up the work.
Right. Should we move on? Point seven, discussion and information of sick district sick bank, sick leave bank, with consideration to the board. This was an agenda item given to us by a couple commissioners about inquiring about sick leave bank. And, we did a lot of research, we got an opinion from
Yes.
an attorney, and, if you know, I first saw it, said, well, I thought it's a big deal. Create have a donation back for sick time. But there's lots of variables that we have to consider before moving forward. And I'm not up on this one, Tina, so you're gonna have to.
Nope, that's fine. Absolutely not a problem. So yes, this came as a board recommendation. And what basically is going to give you a little bit of history. We kept hearing this elusive, idea that this has been done in the past. And so really kind of dug in and looked at some of our more veteran people on staff and asked some questions. So yes, indeed. In the past, we have used sick day banks on special occasions in the past. It was always done on a very limited basis, based on need and based on very specific ideals and thoughts in a very short window. I will say that at one point, I would render to guess it was back in the early 2000s, people were allowed to donate sick leave days into a pool, and it was made very clear at the time that the donations were taking place that if they were not used, you would not receive them back. And so there were well over 100 days. And with those days, then it got really interesting because not all the days were used, and some of them were, and it just got really, really ugly. And some of you nodding maybe remember when that happened. But the employees that I asked, our veterans that I asked, were like, this did not turn out well. And at that point in time, the district vowed, absolutely, we are never doing this again. Again, in a survey of 28 other districts in the state, 0 out of 28 offer this option as an option. It is the legal opinion of our attorneys, the district attorneys Renning, Lewis, and Lacey, that they do not recommend that the district move forward with this or adopt a policy on an employee sick leave bank donation program. That is not to say that on occasion, if there is something that occurs and the district administration comes together and makes a decision that is in the best interest of an employee or a group or a situation, we certainly would still continue to do that. So it is not an administrative recommendation to move forward with this policy. It is not our legal obligation and recommendation from Renning, Lewis, and Lacey, which is the district legal counsel. Commissioner Hannawell?
When you said you've done it in the past, how have you done it in the past for a specific employee
Yes,
versus a pool?
that is correct. For a
And-
specific employee.
Okay, and are you saying that your recommendation or is, not recommendation or whatever, is that we still could do that for a specific employee, but not create a pool?
Certainly, we would have to have a meeting and it would have to, obviously have a conversation with the administrative team, and they would make decisions based on parameters. But honestly, I think the whole thing gets really messy. I mean, it really does, because who gets it and why do they get it and what happens if this person, it gets really pretty complex. So I think that's why Renning, Lewis, and Lacey are saying, let's not do this.
See, and I guess where I'm coming from is, this is something that I negotiated real hard to get when I was with the county, in that employees could donate. We didn't donate to a specific bank, but you could donate to a specific individual at any given time. There were no parameters. If it looked like an individual was going to run out of their sick time and benefits, they could say, to HR, hey, I could use some help. HR would put out a note and people could donate if they want, with the same understanding that once you donated it, you didn't get it back. And if there was an excessive amount of time donated to that individual and they came back within 2 weeks, the rest of the time was gone. Is there a problem doing that?
So I guess, you're asking, so I will share my thoughts on this. I think we have, as Kevin alluded to earlier, we do have people who, as you said, earn and burn. There are people that do that, right? We also pay out $147 per day for our accrued time, for our sick leave time. So because our employees have that time that they're getting paid out at $147 per day, it's a little harder to give those days up now because they're giving up essentially their health benefits in retirement. And I think you run into, hey, Mr. Smith comes into HR and says, I'm really struggling, and HR knows all of the data. And last year, the last 2 years, Mr. Smith has utilized his sick leave every single year in kind of a earn and burn situation. Now has come to us because he's sick or has somebody in his family who is sick and is asking for this benefit to be given to him. I think for me, there's a I don't know if it's a moral dilemma, but there's certainly some question you have to ask about the employee in that situation.
But if it's a voluntary donation, and I say, Tina burns it up every month she gets, she should have been thinking about this. And yeah, I feel bad that, she's going to be out for 3 weeks because she had her appendix out or whatever. But hey, this is somebody that never banked anything. So if there's a voluntary aspect to it, I guess I don't see the negativity or the problem. I know it's a headache, because now you've got people at different salary ranges donating an hour or 2 hours or whatever. Then and then is it only sick time that you're allowed to donate? Can you donate vacation time or whatever? I don't know. In this case, we're talking only sick time probably, but I guess, it's not where you automatically get it, but you could certainly say,
Sure, and the board has, this committee has absolutely the right to say, hey, this is what we want you to go back, and we can go back and work with Renning, Lewis, and Lacey and create an opinion or an idea surrounding that. I will just say that at this time, it is not the administrative recommendation that we move forward with this, but certainly if you want to give us some direction to go forward and do other things and bring them back at a later date, I'm happy to do that for you.
why is our attorneys opposed to that? Where do they see the issue? Do they see that as a matter of, oh, gee, we gave it to Kathy, but we're not going to give it to Jim?
Yes,
And someone says, hey, you're discriminating against me.
yes.
Okay. I understand that to some degree, but
And we intentionally, obviously we use different firms for different work at different times, right? We intentionally had Renning, Lewis, and Lacey give an opinion on this because they represent over half of the school districts in the state of Wisconsin. And so they have a much broader, vaster view of the field of play in terms of this issue. And this is a practice that is not used in very many school districts at all.
But what you're saying is we could still do it, not develop policy, but still do it on an as needed basis,
We could certainly look at that.
So, okay.
I think Kathy had a question there.
Is okay?
Oh, yeah. Of course.
So, and so this came about because of the last couple of years, and we kind of discovered how fragile we are, and because of concerns about teachers getting sick and with COVID or other complications, and especially new teachers burning through their sick time really quickly. And obviously, and people starting out their careers are in a little less stable, perhaps, or foundational kind of situation. And so And, you know, I know that we could do it on kind of a case-by-case basis, you know, if somebody proposes that. My only concern with that, and while I love the initiative of making sure that people are, you know, taken care of, my concern with that is that that almost sets us up, I'm afraid, for a liability issue too, if there is no policy on the books, you know? And I don't, you know, I don't want to put us, you know, or your department in any sort of a conflict when somebody comes and they say, well, you know, so we did this for our person at our building, now we'd like to do this for this other person, at, you know, in another building perhaps, and then, you know what I mean? So I don't want to, you know, my concern would be about setting ourselves up out of, you know, really good, you know, conscientious kind of actions, setting ourselves up. What I kind of like about Commissioner Hannawal's experience is that it's directed from employee to employee directly. You know, I mean, I get, and I understand why, you know, legal is not all that hot on it, but I guess personally, I just want to make sure that our employees, especially our younger and our newer teachers and staff, aren't put over the barrel in the event of something really drastic happening. And so I don't know if that idea of creating some sort of a policy where I can decide I want to give Jim, you know, some hours personally. This is my decision. The district didn't have to make it. It's not a matter of equity coming from the district than it is. I don't know. That's just my thoughts on it. But thank you.
No, absolutely. And I guess I will just add to, you know, to talk a little bit. The district really worked hard to, in the last 2 years, provide a pathway for our employees to not have to burn their sick time when they were out. Because we had so many that were out due to, you know, having to quarantine because they were exposed and they never were sick. They all got to work Z-COVID remote is what we identified it in the system. So they were working remotely during that time. So they weren't burning through their time as much as one might think during these last 2 years. There were really some great opportunities. Now, that does not apply to everybody, and that's fully understood. We were just doing everything we could and continue to allow them to take time out of their bank time, especially if now we're kind of through a little bit of this, I hope, right? That we still allow them, if they come back and say, hey, I was out for COVID and I had to use sick time during that time, but now I've got, you know, I fell and broke my foot and I've got to be out, you know, what can we do? You know, and so we're really careful and thoughtful and empathetic with our employees to ensure that we're giving them every possible opportunity to use their bank time when they need to use their bank time, or not go into a negative status. And we've really kept pretty good track of that. We don't have many certified staff. That means, you know, pretty much of the 1211, we don't have that many that are in that negative status. But to your point, you know, it's, you know, those beginning employees, those beginning year or two employees, that, you know, we are particularly fragile, but they're fragile anyway, because those first 3 years, let's face it, we all know the petri dish that is education, right? So, you know, we're in it, and until you build up that immunity, you're gonna be sick a lot, and you're going to be taking time, and you're going to be planning families, and that's kind of all part of that beginning working stages. So I'm happy to do what work you would like for me to do. I guess that's what I have to say about that.
Okay. Yeah, I don't think, I think it deserves just a little more study. And if we do something, we do it in writing, a policy that says, under these conditions, we would do that. And this is what it would look like. And you have to look at the different scenarios that can happen. There's different places there. I don't want anyone in a position where they donate something and then it goes out the window and that. But whether it should be to a specific employee, to a pool, to whatever, and I think it's up to us to sculpt something if we want this. And that there's no law that says you have to do it this way or that way.
No, and it
ju-
isn't illegal to do either. Yep, you can.
It isn't illegal.
Absolutely, it is not.
No, so I think it merits a little more study on it before we say yes or no. And under what conditions would we do this? And how would it go about if we do? And there might be several conditions, there might be only one. They maybe say it isn't worth it and just make that decision into policy that we aren't going to do it, or do nothing and
Sure,
let it
and
happen.
I would offer on that I don't think that we should just create it. I think that we need some legal backing to ensure that we aren't looking at discrimination or other pieces.
Right, I don't wanna see something that gets us in legal trouble either, because
Correct.
there are ways we could direct ourselves where we could get caught into something, and we don't want that. So I think it's worth some study to go beyond it, as such, but that's where I would start and then come back and say, this are the options we have, and if we don't wanna do it, fine, if we do, and if we do, how do we do it? So, thank you, Tina, appreciate it, thanks, Kathy.
Historically, have we ever been in a position where someone has exhausted their bank and we've said, there's nothing we can do for you, you know?
Sure,
Okay. But that's rare.
yes, it's right.
I would hope,
We jump through
Um,
about every hoop we can to
we-
try to ensure that employees can use time.
Yeah, because at this point, then, you know, I'm comfortable that and I believe HR and that we do everything to maintain our employees and keep them. So I guess until it really rises to the occasion where we're seeing, you know, a lot of people say, boy, you know, I had to walk away from my job, or I ended up terminated because I didn't have anything in my bank. I don't know that it's worth pursuing too much further, so, especially in a policy, so. Because I guess I would trust HR's judgment, it's worked up to now, you know, so.
So, you know, when I was listening to the discussion and reading the opinion here, maybe we need to ask the question a different way. Because it seems like the opinion was based on creating this bank of, you know, everybody's putting sick time in here, but then how do you administer that? That's the
Yes.
pitfalls, right? But if we do have some past practice, I guess I'd like the committee to at least ask the full board to direct HR to explore a voluntary one-to-one conduit plan. So it's simply, I'm sick, and John is willing to give me some of his sick time. How can we just do that? I think that's, to me, that's different between that and having a pool to administer. Does that make sense? Denise, do we need to make like a formal motion to ask the board for action on something like this? Do you think?
We need to make a motion to put this forward to the full board, but if you're asking for more information from Tina.
Right, to
Go
just come
back.
back to this committee with us.
She can just bring that back to the committee.
You don't need a motion for that.
I mean, you know me, I like getting full board approval before I ask anybody to do more work.
And in this instance, it will be more work, but it'll also be more money too, because, again, because there are legal ramifications for however we do this, we're not gonna be the ones drafting these policies, right? This is gonna be, you know, done by council, and we're gonna be paying as we go, so the board's gotta be serious about wanting to, you know, there's real dollar costs to that. And then I don't say that to deter the board, right? But I just want
Yeah.
you to be aware that in this particular instance, we do not have the expertise to be drafting these kind of policies.
Right, right. So I'd like to, would you like to make a motion to ask the board to,
Give direction.
possible action, give direction to administration to explore this voluntary one-to-one conduit plan?
I'll second that.
I guess I just made the motion. Does that,
Oh, Kevin.
that
Oh,
make
I
sense?
assume that's what you were doing.
Does that make sense to you? And knowing that the superintendent can well explain all the variables involved in that.
Yeah, I like the idea.
So there's a motion and a second?
You already did, didn't you?
Yep. Do you understand the motion?
I understand the motion, I just have a little direction there I'd like to add in. And that is that we give it to the board, like you said.
Microphone?
Thank you. Yeah, that we pass it on to the board and have them give us direction, this is what we're thinking.
Yes?
And give us direction, you wanna go ahead. You don't have to do anything with cost at that point. You're just saying, we're gonna look into it, the possibilities, and then bring it back to the board, whether they wanna go into the defining and legal definitions and all that. So, whatever you think, Kevin, I'm with you guys on this.
So we have a motion and a second. Any other discussion on that? All in favor, say aye. Aye. That passes 3-0. Thanks, Denise. All right, next one. Thank you very much, everybody, for that. Next one, discussion on salary schedule level 9 placement process and consideration to move the full board. So this was Scott's not here, but
Yes, I'm gonna defer to Superintendent Poofall on this. He has the
Okay.
information that is needed to take care of
All right.
this for you. You owe me coffee.
so so this particular agenda item can be a little confusing. So there's materials here. So let me just briefly give you my synopsis of what I interpret this to be. So first of all, I've heard from the employees collectively that they are very grateful for adding level 9 to our salary structure. It ended at 8, now we have 9. All right, so they're very grateful for that because we had several of our employees just keep hitting the top of the schedule. Even though if they did the 45 hours, they got the $1,200 stipend, it wasn't added to their salary. So their salary actually remained flat from anywhere, and please somebody correct me immediately, if anywhere from 3 to 5 years. We have employees that were just constantly, and their salary wasn't going up. So then we rolled out the new salary structure, and there were some rules that were used on where you were placed, and then how you advanced. And that's where it was brought to my attention after we did some of the math, thanks to finance and HR department, that some employees, and this is some sort of inherent result of any time we add or change salary structures. There's people get caught between above and below the line. But in this case, we had some people that moved up the 9 schedule were getting as much as $2,400, and a group of people that were getting $170 increase. Right? And I can go into the more detail on that. So therefore, we discovered there was about 38 individuals that only received the $170. And in my opinion, I didn't think that was equitable or the right thing to do with 38 of our most senior valued employees. Now, there's a lot more detail and different points of view on how this worked. But I am looking, and I'll defer to those that can explain it better. What I'm looking for is this committee to move action to the full board to direct administration to come up with options on how to rectify those that only received $170. All right, and there's more to the story. Who'd like to, would anybody like to explain a little more?
Well, no, first of all, you did a very nice job, actually. So for not having, from just studying it from afar, you were very accurate, right? So everything you said was accurate, right? The administration worked with the JEA, right, a year ago almost now on, putting level 9 into place. And any time you put a new schedule in place or you adjust your schedule, as you pointed out, Commissioner Murray, you always have to make some kind of procedure. You have to put a procedure in place to do placement, right? And so, as is often the case, the procedure is, and the procedure that's used the most often is to say, well, wherever your current salary is, you're going to go up to whatever the next level is, right? And sometimes that can result in a pretty substantial move and a pretty, rich raise, and sometimes it results in a pretty small raise. And in this instance, we had these 39 people that Commissioner Murray is talking about, who all happen to be folks who are off the top of the schedule, right? Who just because there was such a big group of them, obviously there was some effect in terms of what the old schedule used to be that had them where they were in a group, right? And then when they were placed, they went up to the next level, and it was $170.33 or whatever that was, right? And so they ended up getting a small raise. Now they're all eligible. That level happens to be 9A, right? And so they'll be eligible to get a $1,200 raise for the 22-23 school year, and that will go on their base. They will be eligible to get another $1,200 raise, 23-24, to move from 9A to B to C, right, as time passes. And so the new schedule will benefit them significantly moving forward, right? In this particular year, though, of 21-22, they ended up getting their $1,200 stipend, and pretty much all of them had completed their professional development hours to get the stipend, and then they had that small raise in addition to it.
So, for example, the spreadsheet here, this one here, do you guys have that? Carl, this one? Page 1. So if you go down 1, 2, 3, 4, $78,321.54. Placement at 8C plus, or 8D in other words. And then current salary after movement was $80,721.54, right? Placed at 9A, received $2,400, and actually was moved 2 steps, right? Okay. So the individual that brought this to my attention is the very last one on the bottom. $80,517.21. Starting placement the same. Ending placement 9A 80, 687.54, which was $170.33 raise. So you see what I'm getting at, what the discrepancy is there? Just by the math alone?
By the math.
Right. And this individual here, and like individuals, were those few that I was talking about that were banging up against the top of the pay scale from anywhere from 3 to 5 years. Although we're getting the stipend, we're not getting a boost in their salary. In fact, a few of these individuals over time, we're only getting a 0.21% pay raise on their salary. That's 0.2%. They weren't even keeping up with cost of living because, well, they're at the top of the salary schedule and they weren't able to move. So again, the step 9 is trying to rectify that. But purely looking at the math, I think these 38 people, who I consider, well, they are our most experienced senior employees, got the short end of the stick. And therefore, I'm asking, again, that this board collectively ask the full board to direct administration to explore options. One option could be everybody moves 2 steps. One option could be everybody gets a minimum of $1,200. There's people smarter than I that can give us some options on, and then what the fiscal impact it would be. From what I understand, if hypothetical, if we chose everybody got a minimum $1,200, what's 1,200 times 40?
It's about, the rough math, once you add on the add-ons, is about $52,500.
So it'd be about $52,000 that we would need to capture within this current year operational budget to, in my opinion, rectify the math on this. Go ahead.
So you're saying make this retroactive.
It's
That's the first thing you're saying, or as an option.
it's possible you could do retroactive. You could say as of now. I might prefer retroactive, but
Because if we're looking at, because the 52,000 is retro.
That's retro.
So if we said let's go back,
yes,
it's 52,000 that we have to find in the budget.
yes.
If we say make it as effective now, we're only talking what, 2 months of the contract year, and if we say do nothing for the next school year, the 22-23, they're gonna get to 1,200.
Well, so will all employees.
Okay, so
If you
if
do
we,
45, everybody gets it. So we're not just isolating these people saying they're the only ones going to get 12. That's not the case.
oh, no, I understand that.
Right.
So what
But it's the same
we're saying though is if what I'm saying is the third option of just waiting it out till the next school year, they get to 1,200 like other people do, but they're out potentially what they might have been due.
Well,
Oh,
thanks, Patrick. The impact would be if this goes to the full board and if they say go ahead, then, and if the board says do something and we pick something, we'll just say everybody gets 1,200. There's that $52,000 correction, but then moving forward, that elevates all these individuals' salary. And then that affects the math of the salary structure moving into the next budget year.
That's
To what value, I'm not sure, but
Well, no, it affects it again, add 52,000, right? Because becomes a recurring cost.
Yes.
It's not a one-time cost, which is the
Yes.
point you're making right now.
yes, yes. However,
can we hear Dan on that?
sure,
I don't know what I'm asking you, but you're the numbers man, and just, your perspective on that.
I serve at the pleasure of the board.
I'm very pleased.
true.
So obviously it's an item for consideration, right? And so if you're asking, procedurally, sure, you know, if you direct administration to see if this is a viable option, whatever that option is deemed for us to pursue, you know, we'll take a look at that. I can certainly stand here and say, you know, we're not spending quite yet to the penny, right? But we're also not to the conclusion of our fiscal year, right? So Commissioner Murray would challenge and say, so you're telling me we're gonna spend to the penny? So I can say, we're not gonna spend to the penny, right? We have a few open positions. I do, however, if we make it this year, right, and you just touched on it in terms of it is a recurring cost. People will move as they're placed within that 9, right, as well. If they're a 9A, they're gonna move to 9B, so far as they commit and execute the requirements of that movement, right? So that's naturally going to happen. So you are going to see an adjustment if that is, again, the wish of the board. So to bottom line it, I can't sit here and say, yeah, we don't have 55,000. You know, do we have 55,000? Sure. All right. But I also need you to understand that that 55,000 is a payment that's not going to go to Fund 73 or to Fund 46 or to fund balance. So there is an opportunity cost, right? And I'm not saying those are good or those are bad, right? I just need the committee and the board to understand it's an opportunity cost. I will tell you, this is probably the year to do it, if you direct us for it to be done.
Yeah, I kind of go back when this system was put together, which we would have 8, and then to the ceiling. I don't know why we ended up there, but now I'm looking at 9, and I'm not against it, but that means we have a 9A, a 9B, and a 9C. And I guess with the number of people and the opportunity we have within the district, in the future, will we be looking at a 10? Will we continuing to do that? Now, that also pertains to, do we have the longevity out of our employees to actually get that high or higher? Because we always thought 8 would be pretty much the end. At least that's what I remember in the conversation, because we had to create a whole new program at one time. We couldn't have the quote step and lane. So we have a different thing going, and it had to be earned. But my only concern is, what will we have opened up ourselves to for the future in future cost? Because as we talked about earlier, declining enrollment, unless we turn that around for some reason, you know, maybe a new animal park will attract people. I don't know, but students and that. But I do worry about it. I'm not against it. I think we have to have equity across the ways for everyone to get paid equitable. And they have to have ways to achieve that. I'm just concerned, and people should be aware of, what is the future. And other than that, I don't have a big problem with it. It's just that means money we're going to have to come up with. And that, so that being said, I think we should pass it to the board and say, what do you want us to do? I'll vote for moving it up, but I also am putting an obligation on future taxpayers and board members, because we've created more. So I don't say it's a negative. I'm just saying, for the short term, it's a positive. What is it for long term?
I remember having done this at the county when they consolidated 3 unions, and I was the president of one, and we had to figure out, okay, where does a clinical social worker lie versus an outpatient social worker or a clinical nurse and stuff like that. And I think the next following year, we had the county and the union had this problem in a few people, like the infection control nurse, where you only had one. Well, where should that person have fallen? And we realized, well, they fell too low. Let's move them up and rectify the situation. I hear what you're saying, Carl, and I appreciate that. And we all, I think, want to be good stewards of the taxpayers' money. However, I also hold real strongly to the fact that we have an obligation to our staff. And when we're talking about 38 of our staff, as Kevin has mentioned, that are the top of the line, I would hate for someone to say, well, I've maxed out and I'm never, we were at that point a couple of times where, our contracts maxed at 10 years and we had to go in and negotiate a 15-year raise and then a 20, so yeah, there's constantly, okay, we add a 9 and we might have to add a 10 in the coming years, and there's always costs. But these are quality people who've stayed with us at the same time, and so I would hate to lose people just because we say, well, you just gotta live with it. So if you want to move this forward, Kevin, to the full board for consideration, I certainly am in favor of it. I think it's a good idea.
So then I'll make a motion to have administration develop options to address those individuals on the salary schedule, level 9, making less than $1,200. Is that too specific? What? Somebody help me.
It's too specific, and I can argue it's too vague.
Okay.
I think I know what you mean. So I think what you're asking is that we would put some options.
Yes,
Plural,
yes,
together.
yep.
And once we have that together, we could bring it to the board, and then the board can make whatever motion on one of those options or not, and
Okay.
go where you want with it.
So our motion coming out of committee would to have the full board ask administration develop options relating to level 9 salary structure. Understanding we'll have to explain the intent, right? What we're talking about. Yeah?
Yep.
So there's motion and a
I'll
second.
second.
All those in favor?
Aye.
Okay, thank you very much.
I wasn't gonna say no.
Well, you can. All right, the last item we have is discussion and recognition of and reward of all employees with consideration to move the full board. Like we said in the very beginning, it's a constant recognition of administration and the board to continually look at how we recruit and retain and reward our employees. So we had a board agenda request that talked about developing a plan rewarding our employees financially through the use of ESSER funds. Since that item has been brought to us, we felt, based on a couple items, that one was, at the time, we discovered through research that about 1% of all school districts in the state of Wisconsin have used ESSER funds for financial reward. I suppose that was a couple weeks ago, but I suspect it's pretty close to that. Also, we discovered discussion about and feedback from the community about best use of ESSER funds. And in my opinion, there's risk involved of using ESSER funds for a financial reward at this time. And again, this is just my personal feeling about preparing for another operational referendum and being very careful how we use the money given to us from the federal and state, through the state government, when others out there in the community, private and public sector, are all struggling for wage increases. And rewards and recognition. So through other discussions I've had with administration and other in the community, I think it's more favorable if this committee would suggest to the full board to, again, develop some options that the full board can consider rewarding our employees within the confines of the current 21-22 operating budget, which could include and hopefully a financial reward, as well as perhaps, and I'm thinking completely hypothetically, and don't hold me to this, it could address PD days, it could address sick time, it could address vacation time, or any sort of other working condition or benefit and wages in combination of. So that's kind of where the direction is that I was thinking would be more palatable to, and again, just a minute ago, we're talking about $55,000 within the current operating budget. So how much wiggle room do we have within the current operating budget to do that? That's why I think it's important for us to explore options, not strictly a financial reward. Any thoughts on that? Go ahead, Carl.
I think it's wonderful that you're thinking about the financial things in that, but I really think that maybe not just, well, maybe we could recommend that to the full board, that it go back to the finance committee to take a look at it and say, how do we want to do this, these funds? I know we want to do the employees, we want to treat them well as a reward as such, but at the same time, I believe we could make a recommendation that it go back to the board to turn over to the finance committee to do it, or something along those lines, because it is a finance committee eventual and a finance issue for the board itself. I don't know, it's just a thought, but I want to throw that in.
Thank you. I appreciate your concern with the finance, but if this, I'm certainly confident if this gets passed by the full board, that administration would certainly engage all players, HR, benefits, finance, probably even our employees and administration to come up with options, because it's just not finance. It could, although PD, sick time, vacation, all could have fiscal impact, but I think it's a group decision. And when I have this discussion, I'm talking about all employees, just not one group or the other. It's like every employee, food service, custodial, maintenance, paras, teachers, administrators. I'm probably leaving some out, but everybody. So different groups could have different options. So, John.
Okay. It was initially my request for the agenda item with the proposal using ESSER funds. And I think you hit on some of the historical aspects in terms of less than 1% of the districts in Wisconsin have used ESSER funds for bonuses or whatever you want to call it, which becomes what's known as the internal or external comparison, and that makes sense. In mid-March, I met with superintendent and Mr. McCray, and we discussed what my proposal was. And I thank you for bringing in a few minutes ago all staff, because there's a perception right now that's incorrect that this is a JEA union issue, and that's not accurate, because right from the beginning, back in February, when I was prepared to put forth a motion at the February 22nd meeting, I was arguing that we want to recognize all our staff from the top all the way down, that, this has been a concerted effort and it's not just the JEA. So after our meeting and discussion about a variety of things, came to the conclusion or got the direction that to pull the specific motion that I had initially developed and move more towards the line, this type of line. And this is the motion that I'd like to bring forward, that the board task administration to review the current budget and develop a one-time, one-off option to express the district's appreciation and gratitude to all staff and to promote retention of staff and present these options to the full board on May 10th, 2022 for consideration and action. And I think that's something that both Dan and Steve thought was well within a time frame, because I felt bad at the time that, okay, here I'm coming in and now I'm dumping something into Dan's lap, especially saying, okay, now you can fix it. And he reassured me that, yeah, we could, they could do something along those lines. So I think that's what I would like this committee to support and endorse and bring to the full board for consideration, because we're not asking for anything other than administration then to go forward and look at options and then bring it in May 12th. And May 12th was a time frame that would allow administration to look at what's available in this year's current budget.
Before I ask for a second, that's, your motion isn't limiting options just to finance, right?
No,
Okay.
all options, just
Okay,
options.
all right, thank you. So
I just wanted to say what I'm saying is, I want to see the discussion, because there's options, and, because I seconded that, motion or bringing it forward. And I just want to make sure that we do have those discussions as such and that all are involved. So thank you.
we'll bring it to the board, full board, and if they say go, then administration's got some work, and hopefully first meeting in May, we'll have beginning discussions on options, all right. There's a second, motion and a second, all in favor, say aye.
Aye.
Those opposed, that passes 3-0. Announcements or updates? We don't have a next meeting scheduled. I suspect maybe some healthcare, maybe, I don't know. Most of that stuff we're bringing to the full board by now.
Did you get your thoughts in on?
Yep.
No, offhand, Kevin, didn't you mention some thoughts you might have for some additional things or something?
Nope,
No? Okay.
that's the end of
As
our
long as we got
agenda.
it.
We are adjourned.
Thank you, Kevin.
Thank you guys for being here.